Hey guys, thanks for watching my first video. This next video is going to be talking on how we look at gait analysis from a side-on perspective and my key 3 points that are vital to ensure that you are picking up everything that you need when it comes to your side-on analysis for gait. So, the first and most important thing that I look for is where the foot strikes in relation to your body. Is it striking too far in front of your body, underneath your body, or just in front of your body? Although this is really subjective and it varies between patients, having an appreciation and understanding for how far the foot lands in front of the body is a key determinant for affecting the braking forces that occur not only at the foot and the ankle, but proximally up high and through to the knee and the hip and the lower back. So, point number one is this. Have a look at how far that foot is landing in front of the body. That will also determine your rate of pronation, which is really important from your posterior view, but also determine how quickly they can move through stance and through propulsion. Point number two is this. When we're looking at a side-on view, we have a fantastic view of the arch. The arch is something that we always look at as a key determinant from pronation. Now, from a side-on perspective, we can look at how quickly that arch collapses or stays still throughout mid-stance. Remembering our anatomy stuff from the first session, we looked at that talus really plantar flexing and inverting over the calcaneus through heel contact. And the more that occurs, you should find that that arch will collapse slightly further. I always encourage a bit of pronation, but being able to see whether that drops a few mils or not is really important for you to see, one, whether that patient is absorbing shock, two, whether they're not, or whether they're overcompensating and whether that arch is collapsing quite considerably. So, step number two is this. Side-on view, look at your arch profile. Look at whether there's sagittal plane facilitation occurring and pronation occurring within that arch, because that's important for the recoil phase and the propulsion phase. The third and final thing you can look at is their body lean and the position of their neck. Have they got a forward head carriage? Is the head back? Are they leaning forward or are they leaning back throughout gait? This is also really important because this will affect everything that happens in the lower limb as well. So, the 3 points again are this. One, we want to make sure we are looking at their stride length, where their heel contact position point is in relation to the rest of their body. Two, we want to be able to see whether there's any sagittal plane facilitation occurring within the midfoot. And three, we want to look up a little bit higher and start looking at their neck and head and start looking at their body lean, whether it's forward or back, and seeing whether that's a determinant that may be affecting their gait.